Good afternoon, and thank you so much for being patient with us. We did experience a little bit of a technical hitch, but we've got the correct presentation, and this is COVID-19 and the future of transport. It's going to be moderated by Jeff Turner, who's a high volume transport and applied research program. Thank you so much for your patience. We also would like to acknowledge all the panelists in that session, Cyprian, Ian, Anna, Dr. Stanley, and Dr. Fatima. We really appreciate your patience on this.
If I can just share my screen with you for a second, then we can share who we've actually got with you today. And so we're going to hear today from Ana Luisa Silva from the Madagascan NGO ONG Lalana. We are going to hear from Dr. Fatima Adamu at the University of Sokoto in Nigeria, Ian Stott from the Integrated Transport Planning Consultants in the UK, Cyprian Moses from the Tanzanian consultants Hudama Plus, and Stanley Ojikere from the University of Ibadan in Nigeria. And so a range of studies going on, some of which have been funded as part of the UK AIDS transport research investment on the high volume transport research programme. But I think this mostly is an opportunity to exchange live and active research, opportunity to get involved with the researchers engaged in that. And there's an opportunity here right now in the session to raise questions and raise comments and further this discussion, of which there will be a lot towards the end of this. So to do that, please put your questions and your comments in the chat box. And as you're listening to things and towards the end, and we'll further that discussion once we've heard these presentations. So firstly, could I ask Anna to please introduce her to her project, and then we can start. Thank you, Anna.
Thank you, Jeff. Let me share my screen as well. Okay, so thank you, Jeff, for the introduction. My name is Ana Luisa Silva, and I am a member of the NGO from Madagascar called ONG Lalana. Lalana means road in Malagasy language, and ONG Lalana is the only NGO in Madagascar that specializes on road and transport and has been working on these topics for over 20 years. Today, I'm presenting you about our research project entitled COVID-19 Impacts on Women's Peri-Urban Mobility in Madagascar, which is funded by UKAID through the High Volume Transport Applied Research Program. This is a short 3-month project that runs from October 2020, so it's just started, and it will be completed in January 2021. So the goal of our project is to produce evidence on the impact of COVID-19 transport restrictions on the mobility of women in vulnerable groups that live in the peri-urban areas of Antananarivo, so that we can identify solutions and support the development of coherent, inclusive, and gender-sensitive local transport policies and practices in Madagascar and also in other low-income countries. Antananarivo is the capital and the largest city of Madagascar, with a population, with an urban population of 1.3 million, but a peri-urban population of 3.6 million people, which is about 14% of Madagascar's 26 million population. Our research questions, the topics that we are focusing on for this short research, first are the impacts of the COVID-19 transport-related virus containment measures and how they have impacted the lives and mobility of women and vulnerable groups living in these peri-urban areas of the capital. Secondly, we are looking at the experiences in other low-income countries so that we can compare how these changes in Madagascar, how they relate to the experiences in other countries from Africa and Southeast Asia. And finally, we aim to identify solutions both suggested by users and local stakeholders, and also inspired by the experiences that we hear from our colleagues in other low-income countries, solutions that can be implemented in Madagascar, both in the short term and also in the long term post COVID-19. So who is the audience for this research that we are conducting? Is the Madagascar transport users and transport operators, the local authorities, transport ministries, land transport authority officials, but also researchers and policymakers in other countries. The idea is that we can promote the use of participatory research processes in transport research because from the populations that we are working with, they depend on public transport for access to employment in the city, for access to markets. And we believe that together with them, it will be easier to develop solutions that can improve the transport options that are available to them in situations like this pandemic. And we can also contribute to larger transport policy debates in Madagascar and other low-income countries. How are we conducting this research? So we are conducting an in-depth analysis of the situation in 9 sub-districts around Antananarivo. We've selected these districts to be representative. We have districts in the north, south, east, and west of the city. The population in these districts that we have selected encompasses about 120,000 people. And we will compare these experiences with what we hear from other low-income countries. We are using both qualitative and quantitative research methods, but we are focusing on participatory research. So we are doing 2 phases of data collection, first starting with focus groups and interviews with all the different stakeholders so that we can identify the different trends of the impact of the transport restrictions on the mobility of the populations, especially, of course, women. And then as we go further along with our research and we continue discussing with our colleagues from other countries, we will identify specific issues that will need more quantification through more detailed surveys. We will discuss the solutions that we come up with the local stakeholders through a workshop, and we aim to produce a research report, but also a policy brief to be shared with policymakers. What we would like to do is after these 3 months, because it's quite short time for the research, is to focus on dissemination and knowledge sharing so that we can continue our advocacy efforts, especially in Madagascar, but also contributing to the debate in other countries. So far, what have we found out? What we have conducted 10 interviews with experts from countries in Africa and Southeast Asia. In Africa, Kenya, Liberia, Malawi, Senegal, Tanzania, Uganda, Zambia, and Cameroon, and in Southeast Asia, Myanmar and Nepal. In all the countries that we have spoken to, there were various degrees of transport and mobility restrictions that were implemented since March, and these range from total closure and total closure of public transport services in countries like Uganda and Nepal, to partial closures in other countries like Zambia and Myanmar. In all the countries, there were hygiene measures that were implemented and social distancing, the measures that were implemented in public transport. This has led the major trends that we have identified is a rising in transport prices, public transport prices, and an increase in walking and cycling. In almost all countries, market traders are primarily women, and although market trading was usually kept open because this trade is considered basic need, the market traders have found increased difficulties in conducting their trade due to lack of transport available and rising costs. In Madagascar, there were different phases to the restrictions, starting from a total lockdown when there was no transport available between March, April, May, and markets were only open before noon. And then going through a period of partial lockdown, back to total lockdown, again, partial lockdown. And then from September, we have no restrictions to people's mobility, but there are still limits to the number of passengers that public transport can take. From the interviews with the authorities in our 9 sub-districts, we have confirmed that between 70 and 80% of the families are farming families, and these communes have a population of about 55% female. The large share of movement between these areas and the city center are for agricultural trade, especially vegetables that are consumed in the city. And this trade is primarily done by women. What we found so far is that these movement and transport restrictions, from the total closure of transport to partial closure and curfew restrictions, led to decreasing revenues, and also to women walking much more due to transport unavailability and rising costs. Women are in general are complaining of exhaustion and anxiety also about the uncertainty of more restrictions being put into place if a second wave comes along. We will be continuing the focus groups and interviews to exhaust the trends, the finding common trends and issues. We are now speaking to transport operators, market trader associations, women working in duty-free factories that exist in some of our districts that we are working with. And then we will focus on specific issues like price fluctuations for transport and for agricultural products, and women's views on the safety and risk of using public transport and the value of their own time. We hope to start exploring some of the solutions and recommendations ideas with our stakeholders soon. So this is what I had to present with you. Thank you very much. Here are key contacts. If you wanted to know more about our research, we are available. Thank you very much.
Thank you very much, Anna. That's a really exciting and innovative project you've got ongoing. And I think that the key bit is that it's still ongoing. It's quite a short piece of work, and you know, there's opportunities there for further discussion and further interaction with, as you develop that. Okay, so I'd like now to call on Dr. Fatima Adamu from the University of Sokoto in Nigeria to also share with us some work that she was doing. Interestingly, this was a project that was ongoing, focusing on women and transport across a series of countries prior to the pandemic and prior to the public health responses that were in place, and so there was a need to adapt the methodologies and adapt the data collection as a result of the challenges that the pandemic and the responses brought about. So this methodologically is quite an interesting piece. And so I'll call on Dr. Adamu, and if any thoughts or questions or even work that the audience members may already be doing you know, themselves in this area, please use the chat box and you know, put your name and organization, and we can start the discussion later on. So I'll just call on Dr. Adamu to give us a presentation.
Unfortunately, Dr. Adamu's not able to join us today and not been able to record,
Dr.
but we'll
Adamu,
get something from one of her collaborators.
Really very interesting and challenging that you were having to change as circumstances changed around you, and the methodologies and the approaches that you adapted, and the findings, the initial findings that you were finding as things were changing. So I'd like now to call on Ian Stott to give us his presentation on some work that they've also been doing as part of the UK Aid funded HVT programme, which initially has a focus, as I understand, in Asia, but the methodologies and the methodological approach is directly relevant and directly appropriate to some of the low-income settings across Africa as well. So Ian, please, your presentation. Thank you.
Thank you, Jeff. Sorry about that. So hello everyone, my name is Ian Stott. I work for ITP. We are a UK-based sustainable transport planning consultancy. We do a lot of work in low-income countries across Africa and Asia, mainly focusing on bus rapid transit and public transport network reorganisation. My specialism is in accessibility modelling, which is sometimes called connectivity modelling or travel time modelling. And as hopefully you will see, this has a lot of connections with equitable transport networks. The study I'll be talking to you about today takes the experience that we've gained as a consultancy and tries to demonstrate how this can be applied to low-income countries emerging from the COVID-19 pandemic to help them improve their networks going forward. So this kind of concept of building back better, which Jeff alluded to in the introduction. As with Anna's project, we are being funded by the High Volume Transport Applied Research Fund. This study is an even shorter one. It is only a 1-month study. So it's mainly leaning on our previous experience in low-income countries, but we have also consulted with a limited number of international experts, and we are producing a guidance note at the end. So urban transport networks have historically been designed around journeys to work in the formal sector, traditionally considered the primary trip purpose. However, it has been well documented that although this tends to serve the male population well, women's journeys are often for other purposes. For example, unpaid care work, such as taking care of children or elderly relatives, to do household shopping, or for other health purposes. Their journeys also tend to be more complex, taking in multiple destinations in one trip, or trip chaining. They're often likely to travel while encumbered, for example, with a buggy or young children, or heavy shopping. And finally, women usually have less money than their male counterparts and have less control of the household income, which makes them more dependent on public transport or informal transport or paratransit. So COVID-19 has caused a reduction in formal transport services, and this has created several shifts in the paradigm of travel, making it even harder for us to consider journeys to work, and when I say work, I mean formal work, as the primary trip purpose. And it's compounded existing inequalities. So as such, many workers are no longer making their single leg trips to work, reducing the dominance of these trips in line with the reduction of services. Meanwhile, women's typically undervalued trips continue as they remain vital to the functioning of their communities and households. And due to the irreplaceable nature of these trips, the impact of reduction in transport services has disproportionately impacted women. So this has led to our research question of how can urban transport networks be rapidly reviewed, redesigned, and rolled out for a more gender equitable system. So we are already in the process of finalising our insight paper, or guidance document, as we're calling it. The idea is that this can be shared with city authorities and transport operators. And the main intention is for it to increase awareness of the issues we're discussing here and present practical ways networks can be assessed and potentially improved, with the aim of benefiting both the users and the operators. So we're understanding that the context in low-income countries needs to work for the transport operators who are often working on very tight budgets. I'm now going to take you through a brief of the methodology we're proposing rather than the methodology of our research study. So I'm going to present to you 2 diagrams that highlight this methodology. This first one is the existing approach. So the existing approach to transport network design involves input data, which is often in the form of population data, which represents the origins, and some form of destination data. Now, those two things are built into an origin destination matrix of trips, and to do so requires a certain amount of skilled data science and also involves a number of assumptions. So mainly, or most commonly, these are the assumptions that people are traveling to formal workplaces, and the key part of the day to be designing around is the peak trip times. So once you have your origin destination matrix, you can then add in a road network, so the existing potential transport network, and you can start to build a transport model. Now, these transport models are large, complex, and therefore required a highly skilled modeler or modeling team to complete the network design. In large cities with complex networks, all these stages are likely required, but that isn't necessarily the case when we're talking about smaller cities in low-income countries. And when I say smaller cities, I'm probably thinking of around kind of the 1 million population. So not really small urban areas, but anything that doesn't have too complex of a transport network. So this second diagram shows our proposed methodology that we're going to be promoting in our document. So we believe that you can remove a number of the expensive steps through using accessibility modeling. With this, you no longer need the origin destination movement matrix, because the way accessibility or travel time modeling works is by looking at the transport supply. So it's the opportunity to travel rather than making assumptions on the desire of when people will want to travel. You do still need a road network. And so you then combine your population and your destinations with the road network, but this time building it into either a GIS model or an accessibility model. And these are either far cheaper or far more widely available in low-income countries. There is still an opportunity for bias to come into this design, which is where I've put this local experience, because this is acknowledging that there's a certain amount of context that needs to be taken into consideration. And one of the challenges that we've been posed through our consultation on this work is that the destinations that we are modeling around is one of these areas where this bias could creep back towards a male-dominated network. But this can essentially be solved through consultation and making sure women are included in the decision-making process. From a high level, it's kind of saying the central business district is not your key destination. It's far more likely to be local centres where there's more informal economy happening. So our research and guidance document is going to provide the background knowledge of why this is important. It's going to provide the context of how it works. And quite importantly, it's going to point to openly available and often free sources of both data and modeling, things like free GIS tools, free population data that is available to anybody with an internet connection. We're hoping this can be a useful resource, not just post-COVID-19 planning, but for any low-income country city looking to improve the equity of their transport network. The accessibility modeling approach is really good at highlighting gaps in networks and helping you understand who is being impacted by these gaps. So whether that's a geographic gap or a section of the population. Here's our key contacts. Are we quite happy to take questions on this after these presentations, or going forward, please feel free to get in contact with me. Thank you very much.
Thank you, Paul. Thank you, Ian. That's a really interesting sort of methodological contribution to how we do a recovery, what future plans and future processes, not only handling the reality of the pandemic, which is still ongoing, but also the recovery phase, the opportunities that may present. Thank you very much for that. And as Ian says, please follow up with them directly. Please put some questions for our discussion after this, and let's get that discussion started, hopefully. One of the elements of the, for our next couple of presentations, one of the elements of this discussion around gender and the pandemic response is the interaction and intersectionality of a whole range of social groups and social conditions that need also to be understood because of the complexity of everyday life. And one of those intersections is between gender exclusion and gender inequalities and other inequalities across society. One of the main ones being around disability and people with disabilities, and the interaction within households of the burden of health, of caring, but also within the communities and across ages. So it's interesting and important to look at the interaction between gender and disability, for example, to actually understand the condition of the pandemic and its mobility effects, but also in terms of our future planning. And as a result of that, we have two presentations, and I'd like to call Cyprian Moses to give our next one, looking at some of these intersections, but particularly focusing on Tanzania and the impacts of the COVID responses for people with disabilities. Cyprian, please. Thank you.
Thank you, Jeff. Thank you, Jeff. If I may share my screen. Yes, my name is Cyprian Moses. I am a CEO of Huduma Plus Company Limited. We are a research consulting company focusing in Africa and South Asia. This project that we're doing now is called the Impacts of and Response to COVID-19 in Addressing Mobility of People with Disabilities in Tanzania. And it is under the HVT program funded by the UK Aid. And our study is aiming to examine the public bus transit mobility of women, children, and elderly people with disabilities, and how they access a range of services, including homes, schools, healthcare facilities, and workplaces during COVID-19. Sorry, my presentation is, yes. So the ambition is now to help landlocked countries in Central Corridor to find appropriate control measures to protect these people with disabilities. And this will come up with shared lessons for the landlocked countries to adapt, as it is well known that Tanzania is the gateway to landlocked countries of Zambia, Rwanda, Burundi, DRC, Uganda, and South Sudan. So we have a partnership with the Chartered Institute of Logistics and Transport based in London that will help us to disseminate these findings to the wider Africa region. Yes, and also we are now, these are the questions, research questions that we are aiming to find out through our study, and we are examining the policy transition, public mobility, and self-mobility, looking at the role of transport operators, development partners, such as aid agencies, all targeting, looking at the current issues surrounding mobility and access of people with disabilities. So these are the research questions that we are aiming to find out. And then the impact now and the use of our studies. This study will generally inform the design of a policy brief paper, which will now propose follow-up programs to address the identified challenges for public transport operators, as I said before, government institutions also, development partners, and the disability institutions. We also have a partnership with the organization that is dealing with the organization that is an umbrella of all disability agencies and institutions and organizations. It's called Tanzania Federation of Disabled People's Organizations, SHIVYAWATA. This one will help us also to reach out to a wider range of disabled groups of people. And we have prepared a workshop that will be on 24th November. Now, we will call all the stakeholders of disabled groups and also try to look out at the impact of COVID-19. Now, we are not aiming only to look out how the COVID-19 has impacted them during COVID-19, but also we're going to assess the change before COVID-19, what was the mobility, and also during COVID-19, what were the mobilities and challenges, and also now the country of Tanzania is among of the 2 countries in the world that have declared that we do not have COVID. There is no COVID information or status given, but it's a business as usual. So we are going to assess what is the mobility and also the challenges that are faced by these disabled groups during the business as usual period. That is from end of May until now. But COVID-19 Tanzania was between March to, the government declared COVID-19 present Tanzania from March to May. And also before March, you're going to assess what was the status and the challenges that we are facing disabled groups in Tanzania. So that is the impact and use, and the methodologies that we are going to use. I've pointed out that we're going to look at the semi-structured interviews and focus groups. We have arranged a series of workshops to be conducted in Tanzania, calling up for various stakeholders to share ideas and also to exchange what are the challenges and what should be the possible solutions. But also we have arranged for online Zoom-based interviews with other LIC countries that will now get to know the learning lessons and also what are the challenges in those countries that will help us to compare and also come up with the solutions that will be applicable to the local prospects in Tanzania. So we'll have a policy brief. We'll also have a series of evidence-based outputs, short videos for the social networks, disseminating social networks, but also now we'll have an output of now a consolidated strategy document that will be as a guide to the organization of disabled groups on how to adapt in the business as usual, which is described in the nation, but also to prepare the disabled groups for any other unknown or issues that may arise from this period of business as usual. So that is briefly I can say about our project, and thank you.
Thank you, Cyprian, for that description of the work you're doing, the challenges perhaps that you're facing, but also the discussions that perhaps are going on in Tanzania around the next phase and the recovery, but also the interactions, as we were saying, of challenges for people with disabilities and other social groups across society. So that's really interesting to get that research ongoing. And then finally, of our discussion of our presentations today, before we start our interaction and our discussion, I'd like to call on Stanley Ojikere from the University of Ibadan in Nigeria to do his presentation. Please, Stanley, please.
Hello, everyone. My name is Stanley Ojikere. I'm the lead investigator for this particular research project. The research project is titled Analysis of Public Transport Inclusiveness Among Persons with Disability During COVID-19 in Benin City, Nigeria. The team of researchers for this particular project are doctoral researchers from the Department of Urban and Regional Planning, Faculty of Environmental Design and Management, University of Ibadan. The research has a duration of 1 month, running from October to November 2020. And the funding for this particular research project is from the UK aid under the High Volume Transport Applied Research. Looking at the ambition of this particular research project, the project seeks to describe the extent of accessibility and inclusiveness of public transport among persons with disability before and during COVID-19 in Benin City, Nigeria. Looking at the research question, this particular research project seeks to answer the following research questions. Number one, are there inclusive public transport related policy for people with disability before and during COVID-19? What are the perceived effects of public transport exclusion on the travel pattern of people with disability before and during COVID-19? Are there barriers to accessible and inclusive public transport among persons with disability before and during COVID-19? What are the effects of exclusive public transport on sustainable livelihood among persons with disability before and during COVID-19? What are the perceived effects of public transport exclusion on the safety and health of people with disability before and during COVID-19? Are there gender dimensions in public transport exclusion among persons with disability before and during COVID-19? What are the measures to enhance accessible and inclusive public transport recovery among persons with disability in post-COVID-19? Looking at the impact and the use of this particular research project, this particular research project will be used by public transport ministries, department agencies, NGOs in Benin City, Nigeria. What changes this particular project intend to bring? This particular research project intend to bring about responsive and inclusive public transport that focuses on meeting the transport needs of people with disability in Benin City, Nigeria. The outcome of this particular research project will be used to prepare policy briefs as well as evidence-based article in High Volume Transport Journal. This will be used to guide planning of post-COVID-19 inclusive public transport recovery among persons with disability in Benin City, Nigeria. The study area for this particular project, this project was conducted in Benin City. Benin City is the administrative capital of Edo State, located in the southern part of Nigeria. The city extends across 4 local government areas, namely Oredo, Ipobaha, Ego, and Ovia Northeast. The map of the study area is being shown on the slide. Looking at the research methodology for this project adopted a qualitative research approach. The study population for this particular research project consists of people with disabilities, and this include physical impairment, visual impairment, hearing impairment, learning and speech impairment, and all other categories of people with disabilities. Also, personnel for public transport ministries, departments, and agencies were equally part of the study population. Looking at the sample frame and size for this particular research project, the research project had a sample frame of 1,815 people with disability. This cut across all categories of people with disabilities. 68.5% of the sample frame was taken, and that gave us 300 respondents as our sample size. However, during the course of administering our data, we were able to get 202 responses from our sample size. In addition, we work with associations, NGOs in Benin City. These associations and NGOs work with people with disabilities. They assisted us in reaching out to our study population, and that make the work of reaching out to the study population easy for us. In terms of data collection, we made use of interview guide to get qualitative data from the respondents, and also we conducted focus group discussion across all the categories of people with disability. This includes the physical impairment, vision impairment, hearing impairment, learning impairment, etc. Then we conducted key informal interview among personnel in public transport ministries, departments, and agencies. Looking at the initial findings for this particular research project, although bulk of our data, which we gather from the field, is still being analyzed, but the initial findings so far are as follows. We notice that there is no clear-cut inclusive public transport related policy for people with disability either before or during COVID-19. We also found that there has not been any study conducted by public transport authorities across the city to understand the mobility needs of people with disability before or during COVID-19. We noticed that there was no gender consideration for people with disability in public transport services before and during COVID-19. We equally noticed that livelihood sustainability among people with disability was threatened before, and this was particularly made worse during the COVID-19. We equally noticed that women with disability experienced twice as much difficulty than their male counterpart in using public transport before and during COVID-19. We equally noticed that women with disability spend 500% more in public transport than their male counterparts before and during COVID-19. We equally noticed that as part of the mobility coping strategy of the respondent, vehicles were being modified to aid their mobility across the study area. When you look at the slide, you will notice that the vehicle there was being modified. The brakes has been modified. Another part of the vehicle has been modified such that people with disability can easily use their hand in place of their legs. We also noticed that there was no level of advocacy for accessible and inclusive mobility for people with disability across the study area. These are the key contact of people that worked in this particular research. Thank you for listening.
Thank you very much. That was COVID-19 and the future of public transport, with special thanks to Jeff Turner for moderating that session, Cyprian, Ian, Anna, and Stanley for a wonderful presentation. Now, before we take any questions, we have Gina Porter with us. Gina?
Hello. Yes.
Yes, you had a little presentation to give.
Well, I hadn't anticipated doing any presentation. I think Fatima was going to talk about our work with unemployed young women in 3 cities, Tunis, Abuja, and Cape Town. She was going to talk about our work in Abuja, but about the issues that we have faced when we've been, when our data collection approaches that we were using before COVID was suddenly had to come to a stop. We couldn't do any face-to-face interviews. And we moved then to doing studies through the peer researchers we're working with in poor communities in those cities, and they're writing COVID diaries. And I think Fatima was going to talk probably about the findings that have come from that change of direction in the methodology. But there is a website which I can put up, and people are very welcome to look at our work, which is looking in a great deal of detail on how women have moved around or can't move around the poor neighborhoods in the 3 cities where we're working. All right. I'll put that up. But it's a great pity that Fatima couldn't present.
No.
Thank you, Gina, for just jumping in. We apologise if we sort of ambushed you a bit there. But if you were able to share the link in the chat box or something like that, that would be really useful for the audience.
All right. Thank you so much, Gina. She's actually shared it. There's a question for Anna Luisa. I think this was asked by an anonymous attendee, and I believe Anna answered them privately. However, I do think it's a valid question that maybe you could repeat your question for everybody else who's attended to just hear your answer for that. So Anna, can you hear me?
Yes, can you hear me?
Yes, the question was, does the public transport sector in Tana include both private and public sector transport providers? If so, have you seen that COVID-19 has affected them differently?
Yeah, so essentially what I answered in the question, because I wasn't sure if we would have much time, is that the public transport in Tana is essentially private, and it's run by mostly informal operators, informal private operators. The biggest, the most important form of transport are minibuses that are run by cooperatives. And these have been completely stopped during a couple of periods during the crisis, during the last few months. And then for other periods, they were partially stopped. The numbers of passengers that they were allowed to carry were also reduced, and they are still reduced. And so this has led to many of those transport operators losing revenue, losing jobs, and the situation is still not back to normal. And of course, it led to less transport availability for everybody and to rises in prices. And then another interesting thing that we have observed is that there seems to have been an increase in the use of motorcycle and bicycle taxis in the city. And this is something that we are looking into in our research. And it is an interesting point because these forms of transport it seems like they are becoming increasingly important, but they are actually forbidden by law in Madagascar. So this has led to actually those transport operators demonstrating in the city for their activity to be legalized. And it's something that we are looking at closely in the next stage of the research to understand what exactly is their relevance for the people living in the areas that we are studying.
Thank you very much, Anna. We have a question and I don't know if Stanley can hear me. Stanley, how can people get involved in the research and its findings?
Well, I think that's, I think the participants have, also the panelists have shared some of their email addresses in the chat. And so please look at that. Maybe back to the panelists, if you'd like to say anything extra to what you have of how people can get involved on the ongoing research, if it's going along long enough, or if there are some findings that you can make available. Obviously, generally, all of these will be available through the High Volume Transport Research Programme website, which I'll also put in the chat box, but that's transport-links.org. But I'll just check that and put that in the box. So that's certainly a way you can keep track of the outputs. And I know panelists have shared email addresses and you can engage in that conversation. And I'd really encourage, because this is a live area of research, this is also a live audience in terms of researchers and people engaged in this. You've heard some of the active research going on. I know on this call, there are a lot of people engaged in themselves in a range of activities. And so hopefully this is a springboard for interaction and conversation between all involved.
Thank you very much, Jeff. I'd like to invite the panelists that are here with us, logged in live. We have Anna, we have Gina, we have Jeff as well, and Stanley. If any of you can give, all of you can give us your parting shots.
Thank you, for everyone, for the opportunity to present. I would just like to say again that we are open to feedback, and for if you would like to contact us and hear more about this research. The objectives, like I said, are also to bring together experiences from different countries in our research. And we see that there are a lot of issues that are common, that the COVID-19 transport restrictions have led to, for example, an increasing number of people walking and using bicycles, and that many cities are not prepared for this, not just in Africa, of course, elsewhere, but in the African cities that we've been talking to, this is a main issue. And this is something that we will be looking at more closely. But if you would have anything to share as well, that would be most welcome. And if you would like to get in touch with us, I just put my email address, and Lalana's website on the chat box as well. So thank you very much.
Yeah, so I mean, the project I was discussing is, it was a very short study that we've undertaken. And we are in the process of conducting a kind of a pilot run through of the methodology in Mandalay in Myanmar, Asia. But, the methodology really will need refining and will need testing. So if there is anybody who would be interested in being on the contact list for when we're able to forward this out, of course it will be on the HVT website, which Jeff's put a link in the chat to. But if you would like to have it directly forwarded to you when it's available, please just get in touch. I'll put a link to a blog post we've done, which has our contact details. And we'd be keen to work with anybody going forward who would like any further guidance on what we're talking about, or if they would like to actually pilot the methodology in their city.
Thank you very much, Ian. Do we have Stanley? All right, Gina?
Hello. Yeah, I've not anticipated joining this meeting quite like this, but anyway, just to say, the research team which I lead, which has people in Cape Town, in Fatima and others in Abuja and in Tunis, we have got a draft paper that's currently with the journal Transport Policy. And as soon as we know that it's going to be published either by them, or if not by them, by somebody else, we'd be very happy to circulate it, because it has a lot of detail on the sort of issues that were emerging very early on in that period when COVID first hit. So, and really good to hear this other work that's going on. And we'd be very keen to have further discussions with everybody, because our work is funded not by HVT, it's funded by the UK Economic and Social Research Council and the GCRF. And it's going to be a 3-year project. So it's a big project, very, very in-depth, and working very much with participatory approaches, and very keen to interest other people in this style of work, because it's time consuming, but I think that it really adds a richness of texture that contributes substantially to the debates that are going on currently. Thanks.
Thank you very much, Gina. Jeff, if you can hear me, kindly give us your parting shot.
Thank you, Mbeki. Yes, I'd just like to thank all of the panelists and the audience today. I hope this has been useful in highlighting, a rapidly changing area. When perhaps we started the COVID research and HVT program, we expected to be beyond that stage. When we came to present, this is still ongoing, it's still live, it's still active for many people around the world. It's an active area of research, and hopefully these discussions have promoted further discussions and further sharings, further interaction amongst the research community, and that was really the aim for today. So thanks ever so much for that.
All right, thank you very much, Jeff. And on that very informative note, we're going to take our 10-minute break. It's exactly 2:52. We should be back here at 3:02 to continue with our next session. Thank you so much, and see you soon.